Anorexia nervosa by Taylor Keener. Anorexia nervosa has the highest mortality rate of any psychological disorder. The mortality rate is 11 to 12 times greater than the general population's, and the suicide risk is 56 times higher. Rapid and continuous weight loss, purging, fear of gaining weight, dry hair and skin, mood swings, depression and anxiety, obsession with counting calories and food intake, skin is yellow and unhealthy, very low BMI for height and age, excessive exercise, perception of being overweight are just some of the symptoms that are happening to the body and or leading to happening to the body, which is a diagnosis called anorexia nervosa. This eating disorder causes malnutrition that results from self-imposed starvation and can cause complication in every major organ system in the body. A large drop in potassium can cause constipation, abnormal heart rhythms, fatigue, muscle damage, and paralysis. The people who suffer with anorexia have a reason to do this. They take drastic measures to meet how they want to feel and has a difficult recovery time. In my opinion, I believe the media and the environment has the most influence on women and men who strive to be physically fit, a slender woman, and to be a V-shaped muscular man. Body dissatisfaction and internalization of body ideals are high-risk factors for anorexia nervosa that go against the health of both male and female populations. The media give viewers a false view of what people truly look like. In magazines, movies, and billboards, most of these actors and models are digitally altered in multiple ways. People then strive to look like these perfect models, but they are nowhere near perfection. Early theories of the cause of anorexia are linked to maybe childhood sexual abuse, dysfunctional families, or in some cases could be hereditary. Anorexia has only increased diagnosis since 1950. They weigh themselves frequently, eat small amounts, and only eat certain foods. Some exercise excessively, force themselves to vomit, or use laxatives to produce weight loss, says Wikipedia. These individuals feel the need to change who they are or their appearance to feel acceptable, so they take drastic measures. This is a very unhealthy way to lose weight that they want off. A normal BMI for a 20-year-old female is 23. My BMI being 20 is 24 for my height and my weight. The severity of this disease based on BMI in adults with mild disease having a BMI greater than 17. Moderate BMI is 16 to 17. Severe BMI is 15 to 16, and extreme BMI less than 15. In children, BMI for age percentile is less than the 5th percent is often used, says Wikipedia. Treatment for people who suffer with this disorder is difficult because they are afraid of gaining weight. The overall goal to treat and help in anorexia nervosa is restoring the person to a healthy weight, treating the psychological disorder to the illness, and elimination of the behavior of the thoughts that lead to the disorder. Diet is the most essential factor to work in the people with anorexia nervosa and must be tolerated to each person's needs. There is no evidence that different medications or treatments work better than others for diagnosis of anorexia nervosa. Recovered anorexics show reduced activation in the reward system in response to food, and reduced correlation between self-reporting, liking of sugary drinks, and activity. Recovery for people with anorexia is obviously positive, but does not mean it's a return back to normal. Family-based treatment is often better than individual therapy. Every individual who suffer with anorexia are different with every different recovery times. In conclusion, I believe there is always a brighter future. There is always someone to pick you up and help you start over. I believe everyone is perfect in their own special way. I also believe that the media is overrated and does not show the true beauty of people and only show what the people think they want. You only have your body once in this life, and you should show off how unique you are. Thanks.